Hi there, I'm SD Rose, a genetic counselor with JScreen. Today, we're talking about something you may not know much about, Lynch syndrome. Don't worry if you've never even heard of Lynch syndrome. I'm here to break it down for you in simple terms. Lynch syndrome is the most common hereditary colorectal cancer syndrome, affecting about 1 in 300 people. It's also sometimes called hereditary non-polyposis colorectal cancer, or HNPCC, but Lynch syndrome is the name that we most often use. So what is it exactly? Lynch syndrome is caused by mutations in genes that normally help repair DNA damage in our cells. When these DNA repair genes aren't working properly, it significantly increases the risk of developing certain cancers, especially colorectal cancer. People with Lynch syndrome have up to an 80% lifetime risk of developing colorectal cancer, often at much younger ages than typical, sometimes in their 30s or 40s, rather than after age 50. But it's not just about colorectal cancer. Lynch syndrome also increases the risk of endometrial and ovarian cancers in women, as well as stomach cancer and several other types of cancer. So how do you know if Lynch syndrome could run in your family? Look for patterns like multiple relatives with colorectal or endometrial cancer, especially if they were diagnosed young. This may warrant testing for Lynch syndrome. It is important to note that if you have a parent, sibling, or child with Lynch syndrome, you have a 50% chance of having it too. Here's the empowering part. Knowing you have Lynch syndrome can be life-saving. People with Lynch syndrome can benefit from more frequent and earlier cancer screening. Instead of starting colonoscopies at age 45, they might start at age 20 or 25 and have colonoscopies every year or two instead of every 10 years. For women with Lynch syndrome, regular screening for endometrial and ovarian cancer is also recommended. Some women even choose preventative surgery to remove their ovaries and uterus after they're done having children. The key thing to remember is that Lynch syndrome is manageable when you know about it. Early detection through increased screening can catch cancers when they're most treatable or even prevent them entirely. Testing for Lynch syndrome involves a simple blood or saliva test, and genetic counseling can help you understand what the results mean for you and your family. If you have a family history of colorectal or endometrial cancer, especially at young ages, genetic testing is worth considering. Knowledge gives you the power to take proactive steps to protect your health. To learn more about Lynch syndrome testing and genetic counseling options, visit jscreen.org.